now we're going to talk about instructions for after a liposuction procedure. My premise is that all you had was liposuction. So remember, these are instructions that are in general. This isn't medical advice for an individual, relating generally to recovering from liposuction, assuming you didn't have a tummy tuck or breast implants or a facelift at the same time, okay? So again, one of the cool things about recovering from lipo is that a lot of rules that apply to all those other procedures don't apply to lipo. And that's because there's no big open plane that we create in lipo. We create more of a honeycomb pattern within fatty tissue. And yes, your muscles underneath them are sore after this, but we don't open any big space like in a facelift or put a foreign body into your body like a breast implant or all kinds of crazy things like a tummy tuck. We're doing a very organized kind of event under your skin. And what we're going to do now is help you understand instructions based on understanding what happens in your body. So from those, a lot of little channels, and they're close to your muscle, close to your skin. They're close to your skin, and there can be a little bit of bleeding from injection from lipo. That's why it can get bruising. But your skin can also feel a little sore. What's probably causing more soreness is that all this happens very close to your muscles, especially if you're fairly lean. Now, so it's normal to feel sore. Again, the beauty is there's no big open spaces and no implants and stuff, so we don't have to restrict your movements, all right? The only thing we tell you is to wear some pads covered by a compression garment, depending on the areas, generally for 48 hours. And the reason for that is you're gonna have a little bit of drainage out the entry points for 12 to 24 to at most 36 hours. Now we want the pads that we put on you to have dried out, to be quite grossly frank, before you take them off so that it'll be less gross. And we don't want you taking them off when there's still a little drainage, because you don't need to worry about what you don't need to worry about. These things do best covered on their own. While in the setting of wearing those first 48 hours, you're encouraged to be active, and you're going to the bathroom through openings in the garment, by the way. If a pad gets too wet, you replace it, but that's the most of the intrusion we want you to do. So issue one is, and I want to emphasize this, from a physical point of view, you're allowed to be very active after lipo, but you had some anesthesia, right? And the other thing is to understand something called fluid shifts. When we create that honeycomb pattern under your tissues, and if we transplanted fat, we also created a new one in the recipient area, that creates your body to leak fluids into that area. And in medicine, we call those fluid shifts. And what that means is, even though you're leaking some fluid, your body's putting a lot more fluid into the tissues themselves. And their overall sort of metabolic changes in response to what happens during lipo. And the bottom line for that is, you need to drink, and you need to drink things that are rich in what we call crystalloid, which means salt. Things like Gatorade, things like chicken soup. Really important. One big way that you know you're drinking enough is that you're peeing plenty. You should be peeing plenty, okay? And drinking coffee and soda and water aren't enough because they don't have any crystalloid in them. This is why athletes drink Gatorade. So again, for you, it's either Gatorade or chicken soup or stuff like that. Very, very important. But within the realm of doing that, you're allowed to be very, very active. You just have to listen to your own head. So again, there are going to be some people that occasionally feel lightheaded, not because they're dehydrated, because that's another reason you could feel lightheaded, but they feel lightheaded because the thought of pain crosses their mind. They get vagal, and we're going to talk about what a vasovagal episode is next. Thank you for listening.